Morning, everyone. We might get going. There still are a few people to come, but I'm conscious of time, so I will get started. So welcome to the Hospitalised Sports Injuries in Australia webinar. I'd like to introduce myself. I am Alison O'Larry and I'm the Injury Prevention Officer here at Injury Matters. Before I get going, I would like to acknowledge the traditional owners of the land in which we meet today, the Whadjuk Noongar peoples, and extend our acknowledgement to the traditional owners of the lands in which people from across the state are attending. And we'd like to pay our respect to the elders past, present and emerging. So before I get going today, just a little bit of housekeeping. Can everyone please ensure their microphones are muted? And also would love to hear your questions. We've delegated some time at the end of Sarah's presentation for questions. So we strongly encourage you to please send them through to me or us in the chat tab, and we'll go through them at the end of the presentation. Also, if you have more than one person in the room listening with you to today's webinar, can you please send us a quick private message via the chat tab to let us know how many people are listening with you. So a little bit about Injury Matters. We are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the Western Australian community. So we do this through advocating and providing education for injury prevention, as well as providing support for those who are being impacted by injury. Today's webinar is brought to you through our No Injury program with the support of the Department of Health WA. So No Injury is a statewide program which aims to enhance the capacity of injury prevention and safety promotion practitioners and organisations such as yourself to deliver injury prevention activities. So No Injury provides training, resources and networking opportunities. So sport and exercise are a huge part of the Australian culture and contribute to a broad range of positive outcomes, including mental health, improving social skills and promoting physical health. Whether individuals are participating in grassroots sport through to professional athletes, sport does not come without its risks, with just over 58,000 people hospitalised for sports injuries in Australia in 2016-17. In Western Australia, the Royal Perth Hospital Trauma Unit recorded 2,311 sporting or recreational related hospital admissions between 2010 and 2019. So as health or fitness professionals, local governments, community sport, high performance or researchers and academics, what can we do to reduce the risk of injuries from sport and recreation? So before we implement any intervention, it is important to look at the available data to identify trends and priority areas for intervention. Data is the starting component to informed injury prevention and helps us to see the bigger picture, the whole picture. Once we know what our priorities are, we are able to identify opportunities for intervention. And these could be implementing policies on concussions at sporting clubs through to one-on-one training and rehabilitation for elite athletes. So today's presentation by Dr. Sarah Harris will provide an overview of the Australian Institute of Health and Welfare's report, Hospitalised Sports Injuries in Australia 2016-17 with a focus on head injuries. So to continue the discussion on sports injuries, I'd now like to introduce you to Dr. Sarah Harris. So Sarah has completed a PhD at the university, Sarah is a postdoctoral research fellow with the Australian Centre for Research into Injury in Sport and its Prevention. After completing her PhD in 2009, exploring the association of concussion and mental health outcomes in Australian footballers, Sarah joined ACRISP to continue her work in concussion and injury prevention research. Sarah is actively involved in the WA sports medicine community through her previous work in Australian football and as the WA State Chair for Sports Medicine Australia. So I'd now like to pass you over to Sarah. Great, Sarah, I've stopped sharing my screen, so you should be able to jump on yours now.
Thanks, Alison. Thank you everyone for joining us this morning to discuss the latest Australian Institute of Health and Welfare Hospitalised Sport Injury Report. As we do have a large number of people attending today from different locations within and outside of Australia, today won't be interactive. However, Alison will be monitoring the chat box, so please send through all your questions or any comments that you may have. I have left plenty of time at the end to ensure that we do have time to get to as many of your questions as possible. I'd just like to start by we acknowledge traditional owners of this country that we each are standing on today and honours the elders past and present. So injury is a major cause of preventable death and disability in Australia. Whether intended or unintended, most physical injuries can be prevented by identifying their causes and removing these or reducing people's exposure to them. Sport is an area with a lot of injury, but is often not within the realms of injury prevention because sport is for the young, fit, elite, and not often considered a public health issue. However, in this talk, I will show you that sports injury that leads to hospitalisation actually does occur quite frequently. The AIHW is a sporadically produced report which provides a vital snapshot into the hospitalised sports injury in Australia. Please note though that this report only examines sports injuries requiring hospitalisation. So in other words, injuries that were serious enough to require a person to be admitted or to actually stay in hospital. If we consider only a minority of cases require hospitalisation or result in death, we realise that this is only the tip of the iceberg. The majority of injuries are treated within the ED or by external allied health professionals or GPs, or potentially treated within the home or not receiving treatment at all. Injury can be prevented, but we need to understand the injury incidents and the type of injuries that are occurring to actually be able to prevent it. So the sport injury hospitalisation studies are actually quite infrequent, with the first one in Australia publicly available starting back in 2002. With the data for participants aged 15 years and over, the hospitalisation of sports injury is increasing over time, with 31,000 cases in 2002 to 2003, to that exceeding 45,000 for only people aged 15 years and over in 2016 to 2017. To put sports injuries into perspective, 58,500 cases of all ages required hospitalisation in 2016 to 2017. This is only marginally less than the number of cases requiring hospitalisation resulting from transport crashes during this same time period. If we have a look at the number of sports injury cases requiring hospitalisation for each age group over time, there appears to be an upward trend for each category. Ages 15 to 24 years and 25 to 44 years are reporting the greatest number of cases requiring hospitalisation. However, perhaps this isn't a surprise given the types of sports they could be participating in, or these age groups are more likely to have a higher rate of participation. Based on gender, in 2016 to 2017, more than double the amount of males and females have been hospitalised due to sports injury, with males exceeding 40,000 cases in comparison to females that were only at just over 15,000. To see how we compare on a global scale, we can see that public data is missing from a large number of countries. However, we can do a comparison for America, Canada, some of the countries within Europe, as well as Australia. So if we take a quick look at this graph, not accounting for differences in population size, sports injuries requiring admission at a public hospital were greatest for America, followed by Australia, Canada, and Austria. However, it's important to kind of take these findings with a grain of salt, given that there's different protocols around the world for collecting data. So this is more of a rough guide showing how we kind of compare to these other countries throughout Europe. If we have a look at the different sports that are requiring hospitalisations during the 2016 to 2017 period, we can see there's actually a large spread throughout a range of different sports. If we have a look just at these top 10, I would love to know in the comments whether or not this top 10 actually does surprise you. So we have cycling as requiring the largest amount of total hospitalisations, followed by Australian football, soccer, rugby, wheeled motorsports, other forms of football, equestrian-based activities, basketball, roller type sports, and netball. We have to remember though that when we're looking at how many injuries are presenting, it can be quite a biased perspective, as we know that some sports have more people participating, such as Australian football or soccer, than other sports. So if we have a look at these numbers adjusted for participation rate per 100,000, the participation rate is estimated based off Australian Bureau of Statistic data, but it actually does rearrange this top 10 for us. So wheeled motorsports becomes one of the highest sports presenting to the hospital and requiring admission. This is then followed by rugby, which has moved up a couple, roller sports, equestrian. Australian football has now dropped from second down to fifth. Ice skating and skiing suddenly appear, as do water sports, soccer, hockey of all types, and then basketball has now moved into the 10th spot. To put this in perspective to see how this has changed over kind of the last 8 or 9 years, if we compare this to the 2011 to 2012 report, with the 2011 report in blue and the most recent report shown in red, if we're looking only at the numbers for those who are aged 15 years and over, because that's what both reports provided, we can see the same sports are actually within the top 10 for both of these reports, requiring hospitalisation. You'll also notice that they're all greater for the most recent report, with the exception of it being fairly similar for football and other sports, as well as for our more skateboard style sports. Interestingly, there appears to be quite a big jump here when we're looking at cycling, and probably not so such a substantial increase across the board with the other sports. So when we're looking at injury and preventing injury, we're not just concerned about the incidence of injury, we also need to understand what is causing these injuries or the mechanism behind them. So looking at the 2016-17 report only, looking at all the people who have presented and required hospitalisation, falls remains the leading cause of these sporting injuries. We will notice that females are underrepresented and they do have a smaller proportion than males. However, they're actually in the same proportion for each of the mechanisms. So falls, transport crashes, being struck, other unspecified reasons, overexertion, and then to a lesser extent, we have unknown mechanisms, the natural causes or environment, and then something that's physically cut or pierced someone. And then finally, drowning. The type of injuries that people are presenting in 2016 to 17 also do vary quite differently. A fracture was the most common reason for hospital admission, accounting for 52% of all sports injury admissions, followed by soft tissue injury, which accounted for 17% of all cases. If we have a look at base now on body region, we can see that the hip and lower limb, so that's everything from the hip, including the knee, thigh, calf, down to just above the ankle, contributed to the largest proportion of injuries at 28%. This is followed by the shoulder and upper limb, the head and neck, and then to a lesser extent, the wrist and hand, the trunk, and then the ankle or foot. If we were to compare body regions based on gender, females have a higher proportion of hip and lower limb injuries, shoulder and upper limb injuries, and trunk injuries resulting from sports injuries requiring hospitalisation. In comparison, males had a greater proportion of head and neck injuries, as well as wrist and hand injuries. We can postulate why there may be these differences. However, the report actually doesn't go down and break this down into further categories for us. You will note down the bottom right-hand side that the ankle and foot injuries were actually fairly even between both the genders, comprising only approximately 3% of all these sport injuries requiring hospitalisation. This latest report had a special focus on netball, basketball, and the football codes, so rugby, Australian football, soccer, touch football, and then other or unspecified football codes. In this snapshot, it can be seen that the football codes have a greater number of sport injuries requiring hospitalisation in compared to, say, basketball and netball. If we compare the injury distribution for these sports, all the sports reported a large proportion of hip and lower limb injury, followed by a shoulder and upper limb requiring that hospitalisation. Interestingly, basketball, other football, soccer, Australian football and rugby all reported over 15% of injuries as head or neck injuries, with Australian football reaching about 30% and rugby exceeding 30% of total injuries requiring hospitalisation. So why do we care so much about all these different body types of injury? It is not just the physical cost of an injury to a person, there's also a huge financial cost, which is quite a big concern as an individual and also at a society or even a club level. The 2012 to 13 report provided us an insight into the cost of each of these hospitalisations. So the average cost per injury was greatest for our spinal cord injuries, which reached almost $12,000 per injury. This was followed by hip and internal organ injuries, which all required hospitalisation. Now, if we're thinking this is per injury, we can see why the cost would quickly add up. When we look at the total cost per body region, we can now suddenly see why head injury is becoming such a big public health issue. In 2012 to 13, an average cost of approximately $5,300 per case, overall head injury had the greatest total acute care costs of all types of sport-related injury cases admitted to a public hospital. Concussion is a buzzword at the moment. If we look specifically at concussion, it contributed to more than $4.6 million of these costs within this public hospital sector. When we have a look at the rate of the head injury compared to where we suddenly come down to wrist, ankle, etc., we can see why these increasing number of hospitalisations for concussion or for other head injuries is starting to become a bit of a concern. If we consider head injuries increased in 2016 to 2017 by almost 4,500 cases, based on the previous 2012 to 13 average public hospital costings, we may estimate that head injuries in the latest report actually had an average acute care cost in excess of $63.5 million. So potentially, if we're continuing on this trajectory and it's going to be increasing, we're going to be expecting concussion and other head injuries to be costing our healthcare system and individuals a lot more money over the time. And this is before we even start talking about the other physical or social or mental effects of head injuries and concussion. With football codes featuring prominently with head and neck injuries, we can see that over time, all the football codes are attributed with an increase in head and neck sport injury hospitalisations. In 2016 to 2017, head and neck injuries made up almost 25% of all injuries requiring hospitalisation across the football codes. And in that same time period, football codes accounted for 38% of all head or neck sporting injuries requiring hospitalisation. Following the release of the latest report, you may have seen a few media headlines gracing the internet and newspapers, either stating the number of head injuries, or in the case of this example I've put up, using the data to justify why one sport perhaps isn't more dangerous than another. With head injuries featuring on the global stage due to the public publicity of the long-term health effects that we've seen in American football, there has been a push for football codes in Australia, especially, to make their sports safer, and a push to keep kids and to keep adults engaged in each sport. This is one example of how publicly available hospital data can be used and interpreted by the media. So if we take a look at the total injuries where this information is from, while they are correct in stating the injuries are similar for both male and females across these sports, this generalisation doesn't break down the severity of injury, the type of injury, or take into consideration the participation rate. But it does make a good case for rugby if you are concerned about injury in compared to your other sports such as Australian football or soccer. So how is hospital data actually useful to us, and what can we get out of it? This data can be really useful in a lot of ways. It provides us with regular information on what the incidence is and what the breakdown across different body regions or genders or age. It can provide us with a baseline incidence data so we can look at interventions. It assists us in identifying priority areas, so injury, age group, or perhaps sports. It can help us as health professionals, as academics, as researchers to actually look at resource allocation and to see where do we need to be investing more time and what are future trends that perhaps we can actually look at flattening out now before we have to invest more time and money into it in the future. One such example is the Injury Atlas for Victoria, which uses hospital admittance data to provide an interactive map and region-specific breakdown of injury. It's a really cool website that you can get a lot of information out of it for, but is only available for Victorian regions. So this is an example of one of the screenshots that you can get from the Injury Atlas. It not only looks really cool, but it can highlight key priority regions for interventions or for follow-up. It allows for that resource allocation, so you can see where the hotspots are. If you look at the colour coding on the right-hand side with yellow through to that dark browny maroon, you can see where the hotspots are, and in this case, it was unintentional injury. For the data nerds among us, it also allows for really cool longitudinal tracking where we can visualise trends, we can see changes in data over that time as well. While the data may be limited in the form that is available, it does have some other really cool, useful stuff that comes out of it. So for instance, hospital data is currently being used to identify priority child injury areas. to try and look at predicting potential future health outcome areas that may be of concern, or to look at things or to summarise trends over time, such as the snow sports throughout Victoria. It also helps to highlight new areas that may be emerging. So in this case, this is a new study looking at sport-related exertional heat illness, which perhaps many years ago we might not have actually realised was becoming such a big issue within sport. But like all reports and all data, we do have some limitations. And so we can kind of go through and have a look at what are some of these things that could be affecting the interpretation of some of these findings. So while it does provide a consistent insight into sports injuries requiring hospitalisations throughout Australia, some of the limitations may be things such as, namely, the major priorities within each report may vary. So you can see that the one in 2011 to 2012, we were talking about the cost of injury, whereas in this latest report, we actually spoke more about the football codes and touched on basketball and netball. We're limited to only admitted hospitalisation data. This is really the tip of the iceberg. So we do not have the full breadth of understanding of sports injuries as they're occurring throughout the community. It does not capture emergency department attendants, people who are seeing a GP or other allied health professionals such as a physiotherapist. It doesn't capture what is happening and who's reporting it at country football to a sports trainer. We just don't have that information. What we do have though is a really good insight to see who's getting to that severe or critical level that's requiring the use of our hospital system. We're also currently limited in the subgroup breakdowns. So at the moment, that's things such as sport, gender, and those age categories. We don't have regional breakdowns, although Victoria has an extensive reporting system through the Victoria Injury Surveillance Unit, where they've got additional data that they're able to pull and capture. At the moment, as an Australian level, we just don't have access to that information. We also rely on sport information to be captured and to be coded correctly at the time of hospital admittance. So that means that if the information is not coded by the person triaging or admitting someone, when we search for that and when the ARHW pull together the report, they just aren't able to filter for that information. So that means there could be injuries that are occurring that are actually missed. Also, participant information, when we're looking at per participation rate, is actually based on organised sport or formal reporting. So a lot of other sports may not be captured that aren't played in a formal setting, and numbers may not include leisure activities. For instance, let's take you, for an example, you're playing organised basketball as part of a competition and you receive an injury. This may perhaps be captured differently than if you were playing basketball at a social level, say at school during lunch, recess or PE class. So these are things that all lead us to know that the actual extent of our problem is underreported, but it provides a good snapshot of what is happening at the very tip of the iceberg. So what, at the end of the day, does all this mean, and what can we take from this information? Sports injury does have a large financial cost, both to the health system as well as to the individual. But we don't want people to stop playing sport. So there's such great social, physical, emotional, mental health benefits of staying active and of participation. So this is kind of where we come in from our injury prevention and our health promotion hat on, I suppose, to need to ensure that people are participating, but it is safe for them to participate so that we can encourage them to have that healthy, active lifestyle. When we have a look at how we can collect and put together an injury prevention program, we can't proceed to that prevention stage until we know what the incidence is, what the mechanism is. And we need to know this not for just a general level, but how this is actually different for age groups, for different populations, for different demographics, for different sports, different levels of sport, and so much more. So while I have a real passion for head injuries, I mean, that's what my PhD looked at, was looking at the concussion element of it. Based on these findings, head injuries appear to me, and I'm happy to take some comments on it, that they continue to be a key priority area for intervention, as we're seeing that they have such a large cost when they are requiring hospitalisation. So given everyone's very different backgrounds, with everyone who's tuning in today, at the end of the day, we need to take this data, have a look at what's happening within our own sporting clubs, and remember that if this is what's happening just at the tip, we need to look at what we can do at the bottom level to try and make sure that people are actively participating in a safe way and try and reduce that risk of injury as much as possible. Thank you very much, guys. So I've left as much time as possible to hopefully take some questions. Alison, I don't know if you can jump on at the same time. I've seen questions popping up down the bottom.
Yeah, we have had quite a few questions come through. Lauren has been able to jump on the chat and answer a few of them.
Thank you.
Around fatality data. But one of the questions we did have come through from Ronnie Johnson was, he was asking about the recent increase in head injuries and whether that is a result of, is there more head injuries, or are they just getting reported better at the moment?
Yeah, definitely. So there's, that's an awesome question. So there's a lot of discussion around that at the moment. So we know that concussion and head injuries we've become so much more aware of them. So it is a double-edged sword. Is it the fact that they're happening more, or is it the fact that they are presenting to hospital more, especially now that we have campaigns in place to say, if in doubt, sit someone out and then seek medical assistance? I would have to say it's probably a little bit of both. Perhaps what was happening before is they were still occurring, but perhaps the reporting was actually underreported, or people didn't know what to look out for. So let's kind of put aside your other traumatic head injuries, such as eye fractures and traumatic brain injuries, and we'll just look at kind of talk a bit about concussion. When we look just at concussion, we know from research that people previously haven't been aware of what the signs or symptoms are. There was the common misconception that you had to be unconscious to have concussion, whereas we know that that actually happens in less than 10% of cases. So perhaps it is education and people finding out more information about, these are the signs, these are the symptoms. You might have dizziness, you might have a headache, a bit of stumbling could actually be the sign of a concussion, and not just perhaps fatigue or dehydration. That could be leading to people now seeking more medical help. There's also the thing with, if we take concussion, that a lot of people don't know when do you see a GP versus when do you go to a hospital. Concussion takes a while to develop. Concussion isn't just something like a broken arm that you can x-ray and then go, it's broken or it's not broken. So with concussion, it does require monitoring. So perhaps more people are being admitted, so that provides the doctors with a chance to actually monitor them. With concussion, depending on how it occurred, you might also be required to be cleared from any neck injuries. So that would require scans and things like that as well, which do take time and can require a patient to be admitted. So I think that's definitely a really good point, is that this increase that we're seeing in concussion and head injuries doesn't necessarily mean that it was never happening before, but perhaps because it is a more invisible injury, it means that people are now coming forward and actually perhaps the data is just kind of catching up with what actually is happening.
Yeah, okay. It's really interesting topic, that one. Thank you. I have another question from Peter Howell. He has asked, do the stats for rugby include rugby league, or is it just rugby union?
So rugby was combined. Rugby was union and league. If it was not specified, if someone just stated they kind of played some football code or it wasn't clear, that was when it was in that combined or unspecified box. But rugby, yeah, touch rugby was a separate category, and then rugby was both rugby league and rugby union.
Great, thank
which
you.
I know amongst the codes will also cause its own contention.
Thanks. I have a question from Andrew Ross. He has asked, have you seen any data or papers on head injuries in water sports such as surfing, etc.?
There's been a little bit of chat about it. That's in terms of, we know it happens in the non-organised sports where it's not an organised competition. It's a lot harder to kind of capture that data. So I haven't seen any formal reports per se looking at those, but it's certainly been a discussion kind of with those organisations as to how many do we think are happening out there. There may be something out of America or somewhere. I am happy to have another look, and I can, if you note that down, I'm happy to get in touch and kind of talk about that one a bit further. But at this stage, there isn't a whole lot. It probably hasn't received as much attention, say, as your other sports. And if anyone else has read a paper and I haven't seen it, please yell out to me now.
Yeah, okay. I just have another comment from Peter, who said it would be interesting to look at the difference between league and union, especially with the scrum differences.
Yeah, so when we look at other countries and look at what their data or privately researched reports, they always specify league or union, and then you can see differences. But in the report for the hospitalised data, they've just lumped it all together. And even a lot of the reporting, they've just put football code, which means Australian rules, soccer, touch football, and rugby all together in one.
Great, thank you. A couple more questions still. Have you looked at timing of injury in a season? We have noticed we get more knee injuries later in the season. That's from Rodney Johnson as well.
Awesome, thanks Rodney. There is a range of different research looking at time within a match and over the course of the season, having a look at when injury is occurring. There's also ones looking at subsequent injury. That's a Victorian Eastern States paper that was looking at once you got one injury, what was the chance of getting a second one. There is some things in AFL looking at fatigue and players where they've had time out and then jumping back in. In terms of specifically looking at knee at what point in the season, I don't think there's anything that specific. But that sounds like an awesome project if you've got time up your sleeve.
Thank you.
What can I ask for a bit of, Rodney, you have to write in the box, what sport were you talking about? Was it in rugby?
Let me have a look. Field hockey.
Field hockey, okay. I'm much more of a ball sport person. So in terms of field hockey, there could be a range of different factors that could be looking at. And depending whether you travel, the age, all those kind of things as well with loading. That'd be really interesting to have a look at though, if that's a trend that you're seeing.
Great. Thanks. I have a question from Lauren Fortington. She says, what is the next step? How do we use this to champion injury prevention?
Thanks, Lauren. So for everyone listening in, Lauren is one of the directors of the Australian Centre for Research into Injury in Sport and its Prevention. So taking all this data, we need to work out, is it necessary to be having an individualised approach? So do we need something for field hockey? Do we need something for rugby? Do we need something for rugby league versus rugby union? Or is it actually a case that we can look at going out across the board and everyone that is participating in sport kind of falls under the same banner? So I suppose it depends whether we look at it from that top-down approach or that bottom-up approach. In terms of how do we champion this a lot more, we need people to realise that just because you're fit and healthy and engaging in sport doesn't make you immune to the risk of injury. And unfortunately, when injury does occur, it can have serious ramifications. But we don't want people to stop exercising because they're afraid of injury. You know, there's been so many kind of digs at different football codes that, you know, it'd be safe for my kid to go for a walk. And then people talk about, well, if you go for a walk, what is the chance of, transport, with car, road injuries and different things like that. So I think one morbid thing is we're always looking at what can go wrong.
Mm-hmm.
And we also need to keep into mind all the great benefits that we have out of it. So going forward, we really need to make sure that we're emphasising that people should be participating, but looking at how we can make it safer. And whether that's at a strength conditioning level, is that from a physiotherapist perspective, is that the game itself, or is it actually the treatment pathway thereafter? Do people need to know who do you go access and at what point in time? Is it access levels versus, country versus being in a metro area? There's a whole range of questions that we can kind of ask and look at pursuing down the track.
Great, thank you. I have a question from Mohammed. He asked, what is the role of physiotherapy in acute care sport injury in hospital? So
let me just make sure I got that right. So the role of a physiotherapist in acute care in a hospital setting?
Yes.
Correct. So it depends on the setup of the hospital. So a physiotherapist may be required to assess the injury in that setting. So a medical doctor within a hospital setting can only do so much of an assessment, but normally a physiotherapist is brought in at the end to kind of help rehabilitate that injury and to get that functional movement. So often when we present in a hospitalised setting, we're looking at, is it a life-threatening injury or not? And then it can kind of move more into your certain realms. So let's take a leg injury or something that might be put under the care of the orthopedic team, and then that might have a physiotherapist as a part of that. So a lot of the physiotherapists that we see out in the community are more at getting people either preventing injury or getting them back up to capacity or beyond to perform. And in a hospital setting, it's often getting that basic function so they can be discharged and then become an external patient. Hope that answers the question.
Great, thanks.
Is there a role for more physiotherapy use? Perhaps that may help. I'm not sure.
Yeah, thanks. I have another question from Pratik Benjamin, who's asked, are there more occurrences of concussion in contact sport? What could be done to reduce the severity of injury?
Okay, so that's two questions. So we do seem to have a lot more information for head injuries occurring in contact-based sport. That doesn't take out though the head injuries that are occurring in sports such as cycling, which often occur through falls and that collision with the ground or other people. In terms of the severity of injury, this report doesn't go into the details of severity per se. It does talk about things such as eye fractures, intracranial injury versus your concussion, but it doesn't go into the real kind of nitty-gritty of all the severity of injuries that we could be seeing. So in terms of your contact sport, if we're thinking like your ball sports such as football and those kind of things, I'd be thinking that severity really does depend kind of case by case, because you're going to be having a range of different things. I don't have the data to be able to state if one sport will lead to more severe injuries than another. If anyone does have that, please flag it to my attention. But yeah, this current report kind of doesn't break it down based on that per sport, per severity.
Great, thanks, Sarah. So there's a lot of questions and comments coming through, so I'm just trying to filter through them and find the ones that I need to be asking. Sorry. So I've got a question from Jan Galloway. Is there any data about the injury being caused by dangerous play from an opponent or caused by self?
Excellent. So in this report, no, it doesn't go down to kind of that finer mechanism or that cause of injury. In other kind of journal articles and things like that, there is a little bit of things looking at whether someone instigated it in terms of they made an error or perhaps they were reckless or careless. There is a football report, and I think it was with McDizzy that looked at AFL and looked at whether or not it was a poor decision versus not a poor decision. Another one of those things that would be excellent, also may be quite hard to generalise because that could be quite a subjective or an individual decision. In terms of looking at it across the sports, I'm sure sports such as like your cycling where someone instigates a crash or something like that happens, you could probably go through and identify that a little bit easier. But say if you're retrospectively looking at the footage, I'm imagining, say in a game like AFL, it'd be quite hard to tell if someone intended to do something incorrect or if it was a mistake, and who was at fault, whether it was both parties or only one. Often it comes down to looking at when a rule was violated. And if a rule was violated, then did that lead to an injury? So perhaps that could be a more way of looking at it. But in terms of those actual numbers, there isn't a huge amount reporting around that area. Right. People are coming up with awesome new ways to look at things.
Okay, sorry. Just lots of comments. I think that might be all of them. I do, sorry, I'm just trying to, 1 second. Bloody cool. Trying to get through all of these. Where's this question? Oh, I have a question that was just emailed through from Deborah Hilton, who has asked, do you think drones will have much impact in reducing injury rate and the number of hospitalised injuries if they are used over sporting ovals such as footy fields?
Sorry, Alison, can you repeat that question?
Yeah, sure. So do you think the use of drones will have much impact in reducing injury rate and the number of hospitalised injuries if they are used over sporting ovals such as footy fields?
I'm not sure what way that footage would reduce the impact of injury. Perhaps if someone's watching the live footage, they might be able to identify an injury. I'm not sure how the two are associated, to be honest. Maybe it might help us see a different perspective and be able to say, identify someone who might have injured themselves. In terms of how that would stop the severe injuries happening that require hospitalisation, I'm not too sure what the association there is. But it'd be a cool way to look at the data if you wanted to do an analysis.
Great. Thank you. I think that is all of the questions. There's been a lot of comments have come through. Oh, someone has just made a comment. Can we train the media to understand the data and not just make headlines?
Yeah, I think a lot of areas would like that to be the case. I think it also depends AIHW produced this report, not our team or ourselves. But it always depends on the media release and kind of the information you put out there. The most catchy stuff is what will go. I think it's maybe us giving headlines or giving information that can't be misinterpreted. But in terms of having a look at the data, I don't think we can expect journalists to be reading full reports and interpreting it correctly, considering they have to cover such a large breadth of different topics and in a timely way as well.
Great, thank you. I think that is all of them. Great. Thank you so much for your presentation today, Sarah. It was really interesting, and yeah, especially all the information on concussion and head injuries. Yeah, to see the scope of so much more work to be done in the space, hopefully.
Thank you everyone for the excellent questions as well. They definitely, one of the great things about research is when you talk more about it, it often raises more questions than answers, but that's what gets us excited. So hopefully everyone's been able to take away something even small from it today. And I believe Lauren did ask if anyone had any comments or take homes or feedback. So yeah, I'd love to hear what your thoughts are. So thank you very much for having me.
Great, thanks, Sarah. I'll just take the screen back off you to wrap up. There we go. Great. So next steps. So I guess following on from Sarah's presentation, if you're looking for some additional resources, the 10 years of sporting and recreational injuries, that's the data from the Royal Perth Hospital Trauma Unit. That's available on the No Injury website. As well, if you're looking for additional resources on sport injuries, I encourage you to visit the Sports Medicine Australia website. They have produced some great resources, including the Injury Fact Sheet series, which highlights prevention and management for the 12 most common sports injuries. And you can download them for free from their website. I'll send out the Hospitalised Sports Injuries, the full report, which Sarah talked about today, in a follow-up email if you haven't seen the full report yet. So a couple next steps. Injury Matters does have a few other webinars coming up over the remaining of the next financial year. So we have a webinar looking at series 3, actually looking at vision and falls prevention, as well as communicating about suicide and mental health, and also looking at mild cognitive impairment and falls prevention in older adults. We will have a new training calendar coming out for our 2021 financial year. As well, I guess if there are any particular areas in injury prevention that you'd like to learn more about, please do reach out. You know, any opportunities or ideas for training are always welcome. We do have an Injury Prevention Network as well. The Injury Prevention Network meets quarterly to provide practitioners across WA, such as yourself, the opportunity to connect with each other, to share learnings and solutions, and you know, to continue to have conversations like what we were today. Also, our Connected program, so it provides you with the opportunity to help build your professional work network and to keep you engaged in today's conversation. So Connected is a networking program whereby it participants are randomly paired bi-monthly and enables you to have a 15-minute conversation with other people working in the injury prevention space as well. And also, I will be sending out an evaluation link for the webinar today. So if you could please just take a few moments to provide a bit of feedback. It just helps ensure that we're delivering training that's relevant and meeting your needs. So just a bit of a special thanks to a few different people, to the Australian Strength and Conditioning Association, the Australian Centre for Research into Injuries in Sport and its Prevention at Edith Cowan University, as well as Sports Medicine Australia, for your support with today's webinar, particularly your contribution towards promoting the event. And that is the webinar today. So once again, thank you, Sarah, for taking the time to share your wealth of knowledge on in sports injury data and head injuries in particular. And yeah, thank you. If anyone has any, I guess, any other questions or feedback, you can reach me on my email, alari@injurymatters.org.au, and I can put you in touch with Sarah. Thank you so much.